Ever noticed a subtle ache in your knee after you've ramped up your running distance? It's a common scenario that many runners can relate to. But before you throw in the towel on your running goals, let's unravel the mystery of knee pain. Knee pain, especially after increasing your running distance, is more common than you might think. It's a painful reality, but here's the hopeful fix. It's usually a sign that something needs attention rather than a permanent roadblock to your running career. Knee pain isn't a one-size-fits-all kind of deal. It can stem from various culprits like overuse, weak muscles, improper form, even worn-out shoes. So before we jump into solutions, let's unpack some common knee pain types. First, we have the runner's knee, which is characterized by an achy pain around the kneecap, often from overuse or tracking issues. Next, there's the IT band syndrome, a burning pain on the outside of your knee linked to tight IT bands. Lastly, we have patellar tendonitis, a pain below your kneecap caused by inflammation in the tendon. Remember, this isn't medical advice, and diagnosing the exact cause of your knee pain is crucial. But understanding these types can give you a heads up on what might be causing your discomfort. So, how do we get to the bottom of this knee pain mystery? The first step is to consult a qualified healthcare professional. They can assess your pain, pinpoint the cause, and prescribe the best treatment plan. This could include rest, physical therapy, the classic RICE method. That's rest, ice, compression, and elevation. And even orthotics if improper foot mechanics are the culprit. But prevention is key. Avoiding knee pain in the first place is way more fun than dealing with it after the fact. This includes warm-ups and cool-downs, strength training, listening to your body, and investing in proper running shoes. Lastly, a bonus tip: listen to your shoes. Those trusty companions might be silently sabotaging your knees. Running shoes have a lifespan, and worn-out ones can lead to pain. Knee pain doesn't have to be the end of your running journey. It's just a hurdle that many runners face. With the right approach, you can bounce back stronger, pain-free, and ready to conquer those miles. Knee pain isn't a one-size-fits-all kind of issue. It can stem from various causes, each with unique symptoms and triggers. Let's delve into the 3 common types of knee pain runners often experience. First up, we have runner's knee, or patellofemoral pain syndrome. This is characterized by a dull, aching pain around or behind the kneecap. It's often the result of overuse or a misalignment of the kneecap. Picture it as your kneecap going off track. You might feel this type of pain after a long run when you're going downstairs or even after a prolonged period of sitting. Next, we have IT band syndrome. This is a sharp, burning pain on the outside of the knee, and it's caused by the inflammation of the iliotibial band, a thick band of tissue that runs from your hip to the outside of your knee. If this band is tight or inflamed, it can cause friction over the knee joint, leading to pain. This type of pain is often felt when your foot strikes the ground while running, and it may not go away until you stop running. Lastly, we have patellar tendonitis, also known as jumper's knee. This is a sharp pain just below your kneecap. The cause? Inflammation in the patellar tendon, which connects your kneecap to your shin bone. This type of pain is common in runners who also participate in jumping sports or activities. The pain is typically worse when running uphill, jumping, or climbing stairs. Now remember, these are just common types of knee pain, and it's crucial to get a proper diagnosis from a healthcare professional. Misdiagnosing your pain could lead to ineffective treatment and potentially more damage. It's also important to note that anyone can experience these types of pain, not just runners. Understanding these types of knee pain can equip us better to address them. Having this knowledge allows us to be proactive, seeking help when we need it and taking the necessary steps to prevent further injury. Remember, knee pain is a signal we need to listen to, not a sentence we have to accept. So how do we solve this knee pain mystery? First and foremost, it's important to remember that while understanding the common types of knee pain can be helpful, self-diagnosis can be risky business. Knee pain isn't a one-size-fits-all problem, and the underlying cause of your discomfort could be more complex than it seems. That's why seeking professional medical advice is absolutely vital. A qualified healthcare professional can assess your pain, pinpoint the cause, and prescribe the best treatment plan tailored specifically for you. The treatment options may vary depending on the diagnosis. For some, rest might be the best medicine. I know, the dreaded R word, but sometimes giving your knee a break is key to healing. Your body needs time to repair and rebuild, and pushing through the pain can often lead to further injury. For others, physical therapy might be the path to recovery. This can involve a variety of strengthening exercises and stretches that are tailored to your specific needs. These exercises can help to build up the muscles around your knee, providing more support and reducing the strain on your joints. You may have also heard of the RICE method: rest, ice, compression and elevation, your classic injury recovery buddies. This method can help to reduce inflammation, alleviate pain, and speed up the healing process. And then there's orthotics. If improper foot mechanics are the culprit behind your knee pain, these supportive inserts can be game changers. They can help to correct your gait, distribute pressure evenly across your foot, and provide the support your feet need to keep you running pain-free. But remember, the right treatment plan is crucial for a successful recovery. It's not about quick fixes or band-aid solutions. It's about understanding the root cause of your pain, treating it effectively, and taking steps to prevent it from recurring in the future. Remember, the right treatment plan is crucial for a successful recovery. Prevention, as they say, is always better than cure. Now let's dive into the world of prevention, because trust me, avoiding knee pain in the first place is way more fun than dealing with it after the fact. So, here are some pro tips to keep you running pain-free. First things first, never skip your warm-up and cool-down sessions. Dynamic stretches before running prep your muscles and joints for the task ahead, while static stretches after your run help cool down your body and prevent tightness. Think of them as bookends to your run, keeping everything in place and functioning smoothly. Next on the list is strength training. Building strong muscles, especially around your legs and core, supports your joints and improves running form. It's like giving your knees their own personal bodyguards, ready to take on the pressure and impact of running. So, incorporate strength training into your routine and your knees will thank you. Now, this might sound obvious, but it's important, so we're going to say it anyway. Listen to your body. Don't push through pain. Your body is wise, and it's telling you something. Rest when needed, gradually increase your mileage, and pay attention to any warning signs. It's not about being the fastest or running the furthest, it's about running smart and running healthy. Last but definitely not least, gear up. Invest in proper running shoes that fit well and provide good support. Your feet are the foundation of your run, and the right shoes can make all the difference. It's not just about style or brand. It's about finding the right fit, support, and cushioning for your unique running style and stride. To sum up, prevention is all about being proactive. Warm up and cool down. Strengthen your muscles. Listen to your body, and invest in good running gear. These might seem like simple steps, but they can make a world of difference in preventing knee pain. Prevention is the key to keep you running pain-free. So take these tips to heart, and let's keep you running strong and pain-free for miles to come. Did you know that your running shoes might secretly be causing your knee pain? Yes, those trusty companions you count on for every run might be silently sabotaging your knees. You see, running shoes have a lifespan, and pushing them beyond that can lead to discomfort or even injury. So, how do you tell when your shoes have clocked too many miles? There are a few telltale signs. If the midsole feels too soft or the tread is worn out, it's time to consider a replacement. Also, if you notice uneven wear, it could mean your shoes aren't supporting your foot's natural movement anymore. Choosing the right pair is equally crucial. Look for a good fit and proper support. Remember, a shoe that works for your friend might not work for you. Everyone's feet and running styles are unique. Your shoes can be your best running partner or your worst enemy. The choice is yours. Feeling disheartened? Don't be. It's time to turn the tide and dive into the sea of inspiring comeback stories from runners who battled knee pain and emerged victorious. Let's start with the tale of Sarah. A marathon enthusiast, she was sidelined by a severe case of runner's knee just weeks before her first ultramarathon. Instead of giving in to despair, Sarah sought professional help, embraced rest, and immersed herself in physical therapy. It wasn't an easy journey, but her dedication paid off. 6 months later, she crossed the finish line of that ultramarathon stronger and more resilient. Then there's Tom, a trail runner who developed IT band syndrome from ramping up his mileage too quickly. He was devastated, fearing he might never run on his beloved trails again, but Tom wasn't about to let that happen. He consulted with a physiotherapist, started strength training, and gradually reintroduced running. Today he's back on the trails, running pain-free and feeling more powerful than ever. And we can't forget about Lisa, a seasoned runner who started experiencing patellar tendinitis. She took it as a wake-up call to reassess her running form and gear. With the help of orthotics and a new pair of running shoes, Lisa managed to alleviate her knee pain. Now, she's not just running, she's soaring. with a newfound respect for her body's signals. These are just a few of the many triumph stories echoing in the running world. They serve as a beacon of hope, a testament to the power of perseverance, and a reminder that knee pain is not the end of the road. Knee pain is a signal, not a sentence. With the right approach, you can conquer it. So take a leaf from Sarah, Tom, and Lisa's books. Seek help, stay patient, and keep the faith. Before you know it, you'll be back on your feet, stronger and more determined, ready to write your own inspiring comeback story. Are you ready to conquer your knee pain and keep running? We've covered a lot today. From understanding different types of knee pain to exploring treatments, prevention strategies, and even how worn-out shoes might be a silent saboteur. But remember, this journey isn't a solo one. There's a whole community of runners out there who've been in your shoes, pun definitely intended. So, let's turn this into a conversation. Have you experienced knee pain after increasing your running distance? Or do you have tips to share that helped you bounce back stronger and pain-free? Maybe you have questions or need a little encouragement. Whatever it is, we want to hear from you. Drop a comment below and let's keep the conversation going. Remember, knee pain is a signal, not a sentence. With the right knowledge, tools, and a supportive community, you're not just overcoming knee pain. You're setting yourself up for a stronger, healthier running journey. Knee pain doesn't have to slow you down. With the right knowledge and tools, you can overcome it and get back to crushing those miles. Thank you for watching. If you enjoyed this video, give it a thumbs up, subscribe to the channel, and hit that notification bell so you never miss a video.